Okay, so you've decided to do a breast augmentation. Now the next question is, what implant do you want? It's not just about, oh, my friend has 300, so I like hers, and then you get 300. There's a lot more to consider when it comes to getting implants. So the first question is about shape of the implant. Do you want a round or a shaped anatomical implant? I would say most people, 90+% of the people that get implants do round. The anatomical implants I do like, but they have a textured surface, and since texturing has some issues related to it, or we're still trying to figure out exactly what the issue is with it, I use those in select cases. So most of my patients that I see are going to get a round implant. Okay, so round gel implant. Now, what about size? So the next thing we do is we measure your chest width. Some people are narrower, some people are wider. It helps guide what size implant we're gonna place because there are thousands of implants available. So we'll do a brief exam and we'll measure the width of your chest, and that gives us a sense of, okay, where in the implant inventory will you kind of fall into. Next thing we ask about is, well, how much of an augmentation do you want? Do you want a little augmentation or do you want a lot of augmentation? And so then that's where we talk about projection. This is the hard one for people to understand. Projection is how much that breast implant projects from your chest wall. So think of yourself in lateral positioning, right? So the lateral look of your breast, do you want a little bit more projection off the chest wall or a lot more projection? And that determines which profile of implant that we use. So there's multiple profiles for the manufacturers. Moderate plus, high profile are just a few as an example. And you help guide us, okay, a little or a lot. And it also depends on how much you start with. So some people come in with very little of their own breast tissue, and even though they're not necessarily looking for a super huge difference, we gravitate toward the high profile because they're starting with so little. So we have to take into account what you currently have, what your current anatomy is, and then what you want to accomplish. The other thing that we have, very fortunate to have at the Nadiri Center, is that we have a 3D imaging called the Vectra. So not only do you come in with some of these ideas, but then we can create a 3D image of your breast and use the computer imaging software and basically add the implant and really fine tune what your end result will be. Because ultimately, we want you to be happy, and we don't want you to end up at the end result saying, oh, I wish I'd gone bigger or I wish I'd gone smaller. We want you to be educated, pick the right implant for you with our guidance, and then have a very successful augmentation.